What if I told you that cold feet, leg pain while walking, numbness, and weak circulation after 60 are not just old age? And that one simple vitamin, not magnesium, has helped thousands of seniors restore blood flow to their legs? Doctors were surprised, and most people have never even been told about it. Now the main narration begins. As we cross the age of 60, many people quietly start noticing changes in their legs. Walking a short distance feels harder than it used to. Calves may cramp at night. Feet stay cold, even in warm weather. Some people feel tingling, numbness, or a heavy feeling in their legs. Others notice swelling around the ankles or slow-healing skin. Most are told this is normal aging, or they're given painkillers and told to walk more. But here's the truth most people never hear. These symptoms are very often linked to reduced circulation, and reduced circulation is not just about blocked arteries or cholesterol. It's also about how flexible your blood vessels are, how well your red blood cells deliver oxygen, and whether your nerves and muscles are receiving enough energy to function properly. As we age, our blood vessels naturally become stiffer. The inner lining of the arteries, called the endothelium, doesn't respond as well as it once did. Nitric oxide production declines, which means blood vessels don't relax and widen as easily. At the same time, oxidative stress increases, damaging cells and slowing down repair. All of this reduces blood flow to the farthest parts of the body, especially the legs and feet. This is why leg circulation problems are so common after 60. Now many people immediately think of magnesium. And yes, magnesium is important for muscle relaxation and nerve signaling. But magnesium alone does not address one of the biggest hidden causes of poor leg circulation in older adults. That cause is declining vitamin B12. Vitamin B12 is one of the most misunderstood and underdiagnosed nutrient deficiencies in people over 60. In fact, studies suggest that a significant percentage of adults over 60 have low or borderline B12 levels, even if they eat normally. Here's why that matters so much for leg circulation. Vitamin B12 plays a critical role in red blood cell formation. Without enough B12, red blood cells become larger, weaker, and less efficient at carrying oxygen. This means your muscles and nerves, especially in the legs, are literally being starved of oxygen. When tissues don't get enough oxygen, they fatigue faster, cramp more easily, and heal more slowly. But that's only part of the story. Vitamin B12 is also essential for nerve health. It helps maintain the protective coating around nerves, called the myelin sheath. When B12 levels drop, nerves begin to malfunction. This leads to tingling, numbness, burning sensations, and weakness. Symptoms many people mistakenly blame on poor circulation alone, when in reality, nerve damage is part of the problem. And here's the key connection most people never make. Damaged nerves send weaker signals to blood vessels. Blood vessels rely on healthy nerve signals to properly dilate and constrict. When those signals are impaired, circulation becomes sluggish, especially in the legs, where blood has to work against gravity to return to the heart. So low B12 doesn't just reduce oxygen delivery. It interferes with the entire communication system that keeps blood flowing smoothly. Doctors have long observed that people with B12 deficiency often complain of leg pain while walking, balance problems, cold feet, and numbness. In many cases, once B12 levels are restored, circulation improves, walking becomes easier, and leg discomfort begins to fade, sometimes dramatically. Another reason B12 deficiency becomes so common after 60 is digestion. As we age, stomach acid production often declines. Stomach acid is necessary to release B12 from food. Even if you eat meat, eggs, or dairy, your body may not be absorbing B12 efficiently anymore. Certain medications like acid blockers, metformin, and some blood pressure drugs further reduce B12 absorption. This means you can be eating enough B12 on paper but still be functionally deficient. And unlike some vitamin deficiencies that cause obvious early symptoms, B12 deficiency often creeps in slowly. First comes mild fatigue, then cold hands and feet, then tingling in the legs, then weakness, balance issues, and pain while walking. By the time it's obvious, nerve and circulation damage may already be well underway. What surprised many doctors is how often improving B12 status leads to noticeable improvements in leg circulation symptoms, even in people who had been struggling for years. Now, this doesn't mean B12 is a miracle cure or that it replaces medical care. But it does mean that one overlooked vitamin may be playing a far bigger role in leg health after 60 than most people realize. In the next part, I'll explain exactly how vitamin B12 supports blood flow at the cellular level, what signs suggest your legs may be affected by low B12, and why some forms of B12 work much better than others, especially for older adults. Now let's go a little deeper, because understanding how vitamin B12 works inside the body helps explain why its effect on leg circulation can feel so noticeable and sometimes even life-changing after 60. Inside your bloodstream, red blood cells are like tiny delivery trucks. Their job is to carry oxygen from your lungs to every tissue in your body, especially your muscles and nerves. Vitamin B12 is essential for making these red blood cells the right size and shape. When B12 is low, red blood cells become abnormally large and fragile. They don't move smoothly through small blood vessels and they don't release oxygen efficiently. The legs are usually the first place this problem shows up. Why? Because they are farthest from the heart and require strong circulation to overcome gravity. When oxygen delivery drops even slightly, leg muscles fatigue quickly. This is why many older adults feel heaviness, tightness, or pain in the calves after walking short distances. It's also why some people experience cramping at night or burning sensations in the feet. But B12 doesn't stop at blood cells. It also plays a major role in controlling homocysteine, a natural amino acid in the blood. When B12 levels are low, homocysteine levels rise. High homocysteine damages the inner lining of blood vessels, making them stiffer and less responsive. This damage interferes with the ability of arteries to widen when muscles need more blood, especially during walking or exercise. In simple terms, low B12 creates stiff pipes and weak pumps at the same time. That combination is especially dangerous for leg circulation. Now let's talk about nerves again, because this is where many people finally connect the dots. Healthy circulation depends on healthy nerves. Nerves tell blood vessels when to open, when to tighten, and how much blood to send to an area. Vitamin B12 keeps those nerves insulated and fast-acting. When B12 drops, nerve signals slow down or become distorted. This leads to numbness, pins and needles, cold sensitivity, and poor coordination. Many seniors think, "My legs feel weak because I'm old." But in reality, their muscles may be healthy. They're just not getting clear signals or enough oxygen. Doctors have documented cases where older adults with long-standing leg numbness, balance problems, and walking pain improve significantly after correcting B12 deficiency. In some cases, people who relied on canes or avoided walking long distances regained confidence and mobility simply because their nerves and circulation were finally supported again. Now here's something very important. Not all vitamin B12 works the same, especially after 60. Most people buy cheap B12 tablets and assume the job is done. But absorption is the real issue. As mentioned earlier, aging stomachs produce less acid and less intrinsic factor, both of which are needed to absorb traditional B12 from food and supplements. This is why doctors often recommend specific forms of B12 for older adults, such as methylcobalamin or hydroxycobalamin. These forms are more bioavailable and easier for the body to use. In some cases, sublingual tablets, which dissolve under the tongue, or injections, are used to bypass digestive absorption altogether. This isn't about taking massive doses blindly. It is about restoring adequate levels so the body can do what it already knows how to do: repair nerves, improve blood flow, and deliver oxygen efficiently. Now, let's talk about the signs that low B12 may be quietly affecting your leg circulation. If you often have cold feet, even in warm environments, if you feel tingling, numbness, or burning in your toes, if your legs feel heavy or weak when walking, if you cramp at night or feel unsteady on your feet, these are not just aging symptoms. They are common red flags of B12-related nerve and circulation issues. Another subtle sign is slow healing in the lower legs or feet. Cuts, bruises, or skin irritation that seem to take forever to improve may be linked to poor oxygen delivery and nerve signaling, both influenced by B12 status. And here's what shocked many doctors. Some patients with normal lab values still experienced symptoms. That's because the lower end of the normal range may not be optimal for nerve and circulation health in older adults. Functional deficiency can exist long before numbers drop into the officially deficient category. That's why symptoms matter just as much as lab tests. In the final part, I'll explain how restoring vitamin B12 fits into a bigger circulation support plan, what results people commonly notice over time, and why this vitamin works best when combined with simple lifestyle habits, not extreme treatments. Now let us bring everything together and talk about what actually happens when vitamin B12 levels are restored, and why doctors were genuinely surprised by the results they started seeing in older patients. When someone over 60 begins correcting a long-standing B12 deficiency, the body doesn't suddenly change, it simply starts working the way it was always meant to. Red blood cells become healthier and more flexible, allowing them to move smoothly through tiny blood vessels in the legs and feet. Oxygen delivery improves, which means muscles don't fatigue as quickly and pain during walking often decreases. At the same time, homocysteine levels gradually come down. As this happens, the inner lining of blood vessels begins to function better. Arteries become more responsive. Blood flow improves not because of forced stimulation, but because vessels can finally relax and widen when needed. This is one of the reasons some people notice warmer feet, less heaviness, and better endurance within weeks to months. Nerves, however, take a little more time, but they respond powerfully. As B12 supports the repair of the myelin sheath, nerve signals become clearer and faster. Tingling and numbness may slowly fade. Balance improves. The disconnect between the brain and the legs starts to heal. Many people report feeling more confident walking, especially on stairs or uneven ground. Doctors were surprised because these improvements often happened in people who had already tried everything else. Pain medications, physical therapy, circulation drugs, with little success. Yet correcting one overlooked vitamin deficiency created changes that nothing else had. Now it's important to be realistic and responsible. Vitamin B12 is not a magic pill, and it does not replace medical treatment for serious artery blockages or advanced vascular disease. But what it does is remove a hidden barrier that was preventing the body from healing and functioning properly. Think of it this way. If your house has good plumbing, but no electricity, nothing works properly. B12 is like restoring the electrical system. Suddenly, everything starts communicating again. This is also why B12 works best as part of a simple supportive routine. Gentle daily walking encourages blood flow and trains vessels to respond again. Staying hydrated keeps blood from becoming too thick. Eating enough protein supports red blood cell production. And managing blood sugar helps protect nerves from further damage. None of this needs to be extreme. Consistency matters far more than intensity. Another key point doctors emphasize is safety. Vitamin B12 is water-soluble, meaning excess amounts are generally excreted by the body. This makes it one of the safer vitamins when used appropriately. That said, it's always wise to discuss supplementation with a healthcare professional, especially if you're on medications or have chronic conditions. What truly changed medical perspectives was how many older adults were walking around with circulation and nerve symptoms that were quietly driven by low B12, and how often those symptoms improved once the deficiency was addressed. So when people ask, why do my legs feel old before the rest of me? The answer is often not age alone, it's chemistry. It's oxygen delivery, it's nerve communication. And sometimes it's one missing vitamin that no one thought to check. This is why vitamin B12, not magnesium, has earned attention as one of the most important nutrients for leg circulation after 60. As we reach the end, here's the most important takeaway to remember. Leg pain, cold feet, numbness, cramping, and poor circulation after 60 are not always inevitable signs of aging. Very often, they are warning signals, your body quietly asking for support. While magnesium, exercise, and medications all have their place, many doctors were surprised to discover how often one overlooked vitamin B12, was at the root of the problem. Vitamin B12 supports healthy red blood cells, protects nerves, and keeps blood vessels responsive. When levels drop, circulation to the legs suffers first. But when B12 is restored, the body often responds by improving blood flow, oxygen delivery, nerve signaling, and walking strength, sometimes in ways people thought were no longer possible. This doesn't mean ignoring medical advice or expecting instant miracles. It means understanding your body better, asking the right questions, and addressing hidden deficiencies that may be silently holding you back. If you or someone you love is over 60 and struggling with leg circulation issues, weakness, or numbness, it may be time to look beyond normal aging and consider whether vitamin B12 is missing from the equation. Because sometimes restoring movement, warmth, and confidence in your legs doesn't require something complicated, just the right knowledge at the right time.